Got it. Okay, it's a pleasure for Chelsea and I to be here today to talk with you about ageism. The program is called Addressing Ageism and Promoting Inclusivity. My name is Molly Hofer, and I'm a family life educator with the University of Illinois Extension. My primary coverage area is the Chicagoland area. I teach in Cook County. I'm a gerontologist by training, so I teach about adult development and aging issues primarily. Chels?
Good morning, everybody. My name is Chelsea Byers, and I'm an FCS specialist with University of Illinois Extension.
And since we only have 3 on at this point, why don't we all introduce ourselves? Ashley, would you like to tell us where you're from and what you do?
Hello, I am from Indiana, the East Central region, and I am a health and human sciences educator with Purdue Extension.
Excellent. Welcome. Katie?
Morning, I'm Katie Dahl from the University of Madison Division of Extension for Oconto County, and I'm in human development and relationships focusing in lifespan.
Very nice. Welcome, Katie. And Beth? Welcome, Mary.
I say, Molly, we have lots of people on now. We have like 12 or more on.
Oh, excellent.
I think you scared Beth away.
I think I did. And I'm sorry, everybody else. I didn't see you all on my screen. So I think then welcome everybody else. I thought I only saw 2 people on my screen. So I think we will forego the rest of the introductions, but you are all very welcome. And we're glad to have you here.
Why don't you all pop it in the chat box? Yeah, why don't you put it in the chat box? Thanks, Kristen.
Perfect.
Yeah, that'd be great.
Thank
If
you,
you could
Kristen.
put name, where you're from, that would be great.
I'm sharing my screen, so my little boxes are small and take up very little room, so I apologize for that. Okay, so what I'm going to do, why don't we get started then, and I'm going to stop video because I like you to focus on the slides versus me with my papers here. Let me see. There we go. The slides were not advancing. Okay, so over the next little while, we know that this is a 1-hour webinar and we have a lot to cover. So we will try to get in as much as possible, but over the next little while, we're going to talk a bit. We'll set the foundation by talking about aging a little bit, definitions, and life expectancy. And then we will go right into talking about what ageism is and how it impacts us, how it impacts older people, how it impacts society. We'll look closely at ageism in the media, in the workplace, and in healthcare as examples. And then lastly, we'll talk about what we do about it, how we combat ageism. So, as far as definitions of aging, this is a definition by Dr. Thomas Flatt, a professor of evolutionary biology. He defines aging as an age-progressive decline in physiological function leading to an increase in age-specific mortality rate and a decrease in age-specific reproductive rate. Now that is a very long and great definition to say that as a species, we are all aging, aren't we? Aging is a gradual process. We don't all age in the same way or at the same rate. And we certainly know that things like environmental factors, lifestyle choices, genetics, disease processes, disorders, healthcare, the healthcare we receive all play a role in how a person ages. So when is a person considered old? How old is old? Let's talk about chronologic versus biologic aging. If we look at, there are several different types of aging, but we'll focus here on chronological and biological. Chronological age, we all know what that is, of course. It is the amount of time a person has existed, and this rate increases at the same speed for everyone. Everyone has a date of birth, and everyone will turn 1 year older every year on that date. Biological or physiological aging is a person's age based on physical functioning. And We do not all age at the same rate as far as biological aging. Again, our lifestyle choices, our genetics, stress, chronic conditions all influence biologic aging. As far as life expectancy, currently in the United States, the U.S. Census Bureau, there are 56 million people in the United States who are 65 years and older, and this represents about 16.9% of the population, almost 17%. I'm sure all of us on the call are aware of some of these demographics. This number is expected to rise to 85.7 million people by 2050. What astounds me globally, we are currently at 600 million people at age 65 and older, and this number will grow in that same time frame to 1.6 billion by 2050 and will represent nearly 20% of our world's population, older adults. Now, in 1900, not that long ago, relatively speaking, life expectancy in the US was about 47 years of age. In 2019, it had risen to 79 years, and then we had a little bit of a dip in 2021 to life expectancy decreasing to about 76 years. And this was due, of course, we can relate it to COVID-19, the pandemic, as well as the rise in opioid drug overdoses. Now, when we think about what contributes to life expectancy and the tremendous change or increase in life expectancy, we can point to healthy lifestyle choices, medical care, improvements in medicine, nutrition, sanitation, education, control of infectious diseases. All of these things point to these improvements. This is an interesting quote, Melissa Underwood. Healthy aging has become a focus in many health agendas. The expression is often coupled with images of smiling, fit, silver-haired seniors undertaking physical challenges or exploring exotic places. While people are living longer and should be supported to engage fully with society, this ideal of hyperactive older adults does not consider the diversity of the aging experience. And sometimes we refer to this type of aging as super aging or super agers. But everyone, we need to really clarify that everyone is uniquely different. And while yes, there are older adults who can run a marathon, there are also older adults who can walk up and down the block of their neighborhood with a walker who are also considered healthy. There is not a blanket expectation for everyone, and each situation is really uniquely different. It is perfectly fine to age gracefully and have the normal wear and tear that happens as we age. And yes, even with that wear and tear, one can still be considered healthy. So we need to really, aging is unique to everyone, which it really sets the stage to talking about ageism, which is sometimes collective stereotyping that can lead to a prejudice. As far as the plus sign, we know that with the older adult population, this group, this is often categorized with a plus sign. It is not uncommon to see 65 plus, 60 plus, 55 plus, 50 plus. This plus sign represents at least 2 generations. Here, if we talk about 65 plus, and I must this is a rhetorical question. Does a 10-year-old have the same needs as a 35-year-old? Does a 65-year-old adult daughter have the same needs as her 90-year-old mom that she cares for? Both of these examples span 25 years, and grouping older adults together lends itself to making generalizations about that group, which, as we know, can lead to ageism. So let's get right into defining ageism. If older adults are living longer, healthier lives than prior generations, with opportunities to contribute to society in meaningful ways longer, why is it that ageism is alive and well? We set the stage by talking about life expectancy and the numbers of people who are older adults. Why is it that if a person lives to old age, they are bound to experience ageism? So what is it? What is ageism? This term was coined by our well-known Dr. Robert Butler back in 1969. He is a psychiatrist, or was a psychiatrist gerontologist, and he defined ageism as a process of systematic stereotyping of and discrimination against people because they are old. The World Health Organization has uh, another definition that is, of course, very similar, but I like how the World Health Organization includes people of other ages because younger people can also be a target of discrimination. Their definition, the stereotyping of prejudice and discrimination towards people on the basis of age. So this does uh, broaden it to other age groups, but I really like their more simplified, perfect example and definition of ageism that you see on the screen. Ageism refers to how we think, feel, and act towards others or ourselves based on age. I think that's a very good definition. Now, ageist beliefs or attitudes can be implicit or unintentional, explicit or intentional. They can be manifested at the individual, societal, and institutional levels. They can be directed at others or toward oneself. It is the only ism where every human is at risk of being a victim should they live long enough. It is a more socially tolerated and often unnoticed form of prejudice, and ageist beliefs are pervasive and ingrained in society. In fact, one estimate, 1 of every 2 people are ageist against older persons in society. And remember, it can be unintentional. As far as stereotypes of aging, stereotypes, as we know, can be negative or positive. They are generalizations made about a group, and if left uncontested, can lead to a prejudice or discrimination against that group. Now, there are plenty of negative age stereotypes about aging and older people. Do we want to put in the chat box just a few that you identify as stereotypes of aging? They can be negative or positive. You can put either. We're focusing more on negative as examples that can lead to discrimination, but positive certainly can as well.
That's a good one. Bad drivers. That's what we hear a lot sometimes, don't we?
Certainly do.
Stubborn. I must be old. I'm stubborn.
Rocking
Rocking
chair.
chair.
Yep, spending the golden years in the rocking chair, right, Mary? Very good. Others that we have here in our lesson. Of course, we hear slow, weak, tired. That's right, Katie. Confused, lonely, isolated. From a positive perspective, I think every time I've talked about aging and asked questions like this, people will say wise, unproductive, unattractive, boring, technologically inept, old-fashioned. Yes, there you go, Deb, technologically challenged. Yes, these are all negative stereotypes, definitely good examples of that. Now, to talk a little bit about Dr. Becca Levy's work, if we talk about how negative stereotypes or beliefs develop, we have to look at messages we receive from others, our societal culture, as well as the media. And Dr. Becca Levy, professor of psychology at Yale University, developed what she calls, it's a theory she developed called the stereotype embodiment theory. And in this theory, she proposes that internalizing negative age beliefs this contributes to adverse health outcomes, and positive age beliefs, on the other hand, can be beneficial to one's health. There are 4 steps, as you see them on the screen here, within the stereotype embodiment theory, or SET, as she calls it, that determine how age stereotypes affect health in later life. Number 1, stereotypes are internalized from society starting in childhood and continue throughout life. And we know that observations, what we see, hear, the people around us, the media, and all kinds of other influences definitely impact us as far as stereotyping. Stereotypes operate unconsciously or implicitly. Stereotypes increase in power as they become more relevant to a person. So if you grow up hearing, Oh, he must be getting senile. Oh, you know, he sure is slow these days. If we grow up hearing these things and internalize it, when we reach an age or as we grow older, we may come to determine and start to think about these things in relation to ourselves. And stereotypes can impact her fourth step, impact health through psychological, biological, and behavioral pathways. As far as psychological pathways, negative age beliefs can contribute to lower self-esteem. Behavioral, fatalistic attitudes about the inevitability of declining health in later life can become somewhat of a self-fulfilling prophecy. And biological, negative age beliefs can increase stress, and that can lead to health problems or even earlier death. This helps us understand that negative stereotypes can certainly be damaging, but on the other hand, positive self-perceptions can be impactful in a good way. And Becca Levy demonstrates this. In 2002, she and her research team utilized data from the Ohio Longitudinal Study on Aging and Retirement, a famous study that took place from 75 to 95. She wanted to determine if positive self-perceptions of aging impacted longevity. Because this longitudinal study had an age belief measure taken at baseline, she was able to use this data and compare it to data, mortality data from the National Death Index. And what she found was that participants with the most positive views of aging were living on average 7.5 years longer than those with negative views. So when we hear people say, think positively, be optimistic, I think we should all take heed. And you might see, if you go to aging conferences, sometimes you'll see people wearing buttons 7.5 years, and that is what they're referring to, this discovery through these studies. Okay, oops. Ageism in the form of microaggressions. This is a very small sample study done by Luke Geitzen that I want to talk about as part of his graduate work in completing an advanced degree in clinical psychology. He explored the connection between microaggressions and aging. He interviewed 51 adults, 65 years and older, about age-related microaggressions directed at them in their day-to-day lives. And he defined microaggressions as everyday verbal, nonverbal, and environmental slights, snubs, or insults, whether intentional or unintentional, that communicate a hostile, derogatory, or negative message, targeting a person based solely upon their marginalized group membership. So he recorded over 300 examples of microaggressions from the 51 participants. 25% of them were removed as not being age-related. He then categorized the responses into these three areas: micro-insults, micro-assaults, and micro-invalidations. The definition of micro-insults: unconscious or unintentional verbal or nonverbal communications that are rude or insensitive. And some of the examples from participants, being talked down to, being called young lady, being offered assistance without asking for it, being offered a senior discount. These were some of the micro insults. Micro assaults, some of the participant examples, these are really more intentional, intended to be harmful. Again, verbal or nonverbal attacks. Being called names. Okay, boomer, hey, geezer, move over, granny, get off the road, geezer, those kinds of insults. Or even being pushed or rushed physically. Micro assaults. Now, as far as micro invalidations, these are often unconscious, verbal or nonverbal communications that invalidate a person's thoughts, a person's reality, a person's feelings. So when a medical provider minimizes medical concerns, well, it's because you are older. Well, you are getting older. Being invalidated emotionally, feeling like I just don't count, or being given age-related compliments. She's 90 years young. You look good for your age. Now, as far as perpetrators of these microaggressions, there were 6 common perpetrators. Service providers like sales clerks, cashiers, wait staff. They were the most common offenders. Then strangers, family, friends, coworkers, employers, and healthcare workers, not surprisingly, these 6. When asked whether participants thought the microaggression was a mistake or intentional, participants perceived microaggressions to be intentional 82% of the time. The study does provide evidence of the existence of microaggressive forms of ageism occurring in the everyday lives of older adults, even as a small study. So in the chat, just very quickly, can you think of common verbal or nonverbal comments you see as microaggressions? Anyone? Just a couple for examples. How about the infamous, "Are you having a senior moment?" I see that as a microaggression.
That's a good one, Katie. She can't help it. She's old.
That's right. Very good. They're not, oh, there, it did show up in my chat. Very good, Katie. Any others?
I think here in Extension, people talk about people when they're getting older and they're like, when are they going to retire? And, people are still very relevant and good at their jobs and things like that. But, people start to talk. Oh, good one. What about teenage behaviors? That is also damaging. Yes, ageism goes both ways.
Absolutely.
It goes both ways.
And Ashley, it's great to point that out. The two ends of the spectrum are often they often experience ageism the most. Not that any of us can be prone to ageism, but from a research perspective, youth and older adults are more prone. Very good.
And if you think of some of the things like driving behaviors, being stubborn, being set in their ways, I mean, there's certain things that you can think of that people talk about that people think about are applied to both ends of those spectrums when you think about teenagers or older adults. Yeah.
Or if you say, "Are you dating?" You're not, you still drive? Yes, that's all of these things. Very good.
Oh, Aaron just added something. Let's see. Talking to a companion and ignoring the elder person. Yeah, somebody's with them. Or Aaron added older adults being dead weight in the workplace. Yeah.
2 excellent examples. Absolutely. Okay, let's move on to, I'm trying to 3 forms or 3 areas where we can cite ageism existing. Or examples of ageism existing, ageism in the media, workplace, and healthcare. So if we think in terms of commercials that hype anti-aging products, surgical procedures to remove lines and wrinkles, incontinence products, pharmaceutical ads, all of these largely negatively portray aging in the media and advertising. And common themes portray older adults as sickly, weak, confused, out of step with the times. And even in television movies, we can see that older adult characters are often portrayed negatively related to aging. And this can influence how older adults see themselves. It can influence how people see older adulthood and aging. In a survey of 750 adults 55 years and older conducted by Age of Majority, a marketing firm that specializes in marketing to older consumers, 2/3 of the respondents indicated that adults 55 and older are represented unfairly in advertising, which that should not seem surprising to us. And some of the 3 stereotypes of older adult consumers that were highlighted in particular are older adults having poor technological skills, physical weakness, and forgetfulness. Now, when asked in the same survey what would make the consumers more likely to purchase a specific product or brand, nearly 55% of the respondents cited being more authentic or realistic when portraying people my age. So we want to see people portrayed related to what aging is for all of us individually. And I don't know how easy or hard that would be to tackle, but many companies do tackle it successfully. And here is one example. And this is a good segue into talking about aging in the workplace. This is an example of a company who took a position against ageism in a positive aging media campaign. And Dove is known for having positive views uh, uh, in many different parts of their campaign. And this is related to aging. And they called this the Keep the Gray campaign to support women aging beautifully on their own terms. And this campaign was inspired in part by the story of a television journalist who reportedly lost her job after 35 years on the job with the network because she chose to let her hair go gray. In a post shared to Instagram, the brand said, "Women with gray hair are being aged out of the workplace, so Dove is going gray." And this is, I think, a tremendous example of doing it differently and doing it well, and a good transition to talk about as we go now to ageism in the workplace. The Age Discrimination in Employment Act, ADEA, was established in 1967 to ensure equality and fairness in the workplace, to protect individuals from age discrimination, and to promote the employment of older workers. Now, today we know that older adults are healthier, living longer than prior generations of older adults. They are often extending their work lives either out of economic necessity or for personal satisfaction. And frequently, older adults are retiring from one job or career and continuing employment in other full-time part or contractual work, or even a second career. It has now been 50 years since the ADEA took effect, and older individuals are still at risk of job loss and ageist attitudes about their performance ability and employability. This is a quote from Victoria Lipnick, who is acting chair of the Equal Employment Opportunity Commission in 2018. This quote is from 2018. "Everyone knows it happens every day to workers in all kinds of jobs, but few speak up. It's an open secret." I'm sorry, that should have come up. I didn't realize it wasn't. In 2022, AARP did a telephone and online survey of nearly 3,000 adults aged 50 and older that explored age discrimination in the workplace. And in this survey of the nearly 3,000 adults, 2,945, 62% of the respondents believe older workers face age discrimination today, 62%. 17% of respondents received negative comments at work based on their age, so could cite ageist comments themselves. And 13% of the respondents indicated being passed up for promotion because of their age. So they were directly impacted in their jobs because of age. Two types of age discrimination experienced by surveyed older workers that are reported most often include getting laid off or fired, or getting passed over for promotions. Some of the negative ageist attitudes about older workers include having lower physical ability, lower mental ability, performing more poorly than younger workers, being less motivated and willing to learn or change, technologically illiterate. We get the picture. Again, negative stereotyping. Once displaced or jobless, older workers face unemployment for longer periods and often take lower paying part-time or contractual work. Ageist treatment has numerous significant negative social and psychological implications for older workers. It certainly increases stress, it can negatively impact self-worth, and can lead to alienation and isolation. Of course, there are many ways older workers bring strength to the workforce. Their years of experience can add ideas in planning and decision making, certainly can add wisdom and a history. They are more dependable, have fewer workplace accidents, less absenteeism, less turnover. As far as ageism in healthcare, our third example, harmful age stereotypes about older people made by healthcare providers can have a negative impact on health and quality of care aging adults receive. The results can be undertreatment of medical conditions, delayed access to care when complaints or ailments are dismissed as part of aging. And I think I gave that example a couple of minutes ago. Older adults themselves can internalize these stereotypes and can attribute their physical symptoms to just getting older. If they're told, well, you are getting older, they can attribute other symptoms to just getting older and fail to get medical care, which of course can impact health outcomes. Ageist attitudes are often demonstrated by healthcare workers, sometimes unintentionally, when talking with older patients. And we all have heard about elder speaking to older adults in a patronizing way, slower speech with increased volume, simplistic vocabulary, repetitious vocabulary, exaggerated articulation of words. Addressing communications to the accompanying family member instead of the patient himself or herself. When elder speak is happening, where we are patronizing or talking down to an older patient, or we are talking about patients in front of them and not including them in the conversation, this can lead to lower self-esteem. It can lead to further withdrawal from social interactions, and it can certainly impact the well-being and appropriate care provision for the patient. I experienced that myself when we were taking my dad to the doctor when at the end of his life. My sister and I accompanied him, and there were often times when the healthcare provider would start talking to us first, my sister and I would always say, Dad, please talk to our dad. He is the one that needs to make these decisions in his care. So it isn't always intentional, of course, but it certainly can be damaging. And lastly, before I turn it over to Chelsea, the shortage of geriatricians. We don't always think about this. This is probably not surprising to you, but there are not enough doctors specializing in geriatric medicine to meet the medical needs of the growing older adult population. We were reporting 7,000 geriatricians in the United States, but I just looked at the ASA Ageism fact sheet for Ageism Awareness Day, and the number is now 8,220 geriatricians in the United States, and this equals about 4 to 5 geriatric specialists per every 10,000 people age 75 and older. We know that is not enough. But research has indicated that medical and nursing students both identify the need for more training in geriatrics and the care of older people. Some of the reasons medical students do not choose geriatrics may be partly related to ageism. Geriatrics is not as respected as other medical specializations. Geriatricians earn less on average than other specialties. Medical trainees that are only exposed to older adults in the hospital setting may not recognize the heterogeneity of the older adult population. And we know it is true that the body changes with age and the risk of developing illness and chronic disease increases with age, but aging and illness are not the same things. Aging is not a disease. Frailty is not the entire story of aging. So those who provide care should have a balanced view of aging with a positive view of the possibilities that later life affords, along with the recognition of the special care that may be needed along the way for the complexities of aging. So I love to close out this part of the talk with a quote by Ashton Applewhite. 60 isn't the new 40, but it is the new 60. And I think it's important when students are going through medical school to really have a full view of what aging means. And that kind of education may actually increase the number of geriatricians. Okay, Chelsea?
All right. You have to flip the slides for me, Molly.
I'm sorry.
All right. So
we always do this in reverse, and Chelsea's the flipper typically.
All right. So Molly really set the stage, about ageism for us. But now, what can we do about it, right? So in this next part, we're going to talk about strategies to reduce ageism. And so we're going to look at policies and laws, education, the language we use, and then really the importance of intergenerational engagement. All right. So let's jump into policies and laws. The policies and laws that are used to reduce ageism, really towards any group, right? Are important. And so strengthening these policies and laws can be achieved at local level, the national level, or even international levels, because ageism happens everywhere. So when we think about policies and laws, we need to really make it clear that ageism is socially unacceptable. We need to think about enforcing behavior change that will hopefully alter people's underlying attitudes and increase diversity in the surrounding workplace and community. So I want you guys to think about, what policies in your organizations could there be to improve that you could have to improve, or to reduce ageism. So what could you have to help reduce ageism if there was a certain policy in your organization, or make it broader? What kind of laws could we have locally in your state or nationally? What should we be fighting for? What should we be influencing our policymakers on? Or what little changes can we be working towards?
One thing that I thought would be really cool when people are in college, they often have an internship or a practicum experience. And I see, why don't we have that kind of experience at any age or any stage in life to kind of try on a new position, to ease into a new position through an internship first? I think that is kind of a cool idea.
Absolutely. So yeah, we got some things popping in. Adding ageism to already existing inclusivity material, accessibility considerations, low vision, mobility, hearing issues, incentives for companies to keep older adults employed. Yes, similar to other populations, aging is a protected class. If you think about it, in elder law, I believe it's 40 and older. So I don't know how old all of you are, but we are all considered elders according to the law. So if you're 40 and older, but when it comes to hiring practices and things like that, but when it comes to actually being older, that's a different story. Molly talked about ages earlier. So yeah, we need to think about retirement and hiring practices, right? Work toward multi-generational workforces and all that can really bring to a workplace. Have a way to ease into retirement. Maybe have people have part-time employment before they actually retire, because they can still mentor new employees. What happens when people leave? They take away all that knowledge, right? Let's see, people have added some stuff. Require DEI training related to ageism. Absolutely. Update training for all employees as new employees come on. The existing employees can be left out of the loop on newer updates. Absolutely. Also think about, flexibility for people caregiving. There's a lot of changes as people get older. They might be caregiving for older relatives or significant others. We need to think about insurance practices maybe. Making long-term care insurance more affordable, protections against financial vulnerabilities in later life. When we think about healthcare, look at individual needs of each person, more person-centered care approaches, and teaching that to people who are working in healthcare, limiting age-biased laws and policies. Let's see, we added some things in here. Yeah, reconsider a 40-hour week and more flexibility. Absolutely, things change as people get older, about energy levels and things like that. And can we, change what that looks like and be more flexible with our workplaces? Great stuff in the chat, everybody. Thank you. So we have a little quote here. Ageism is about attitude, and attitudes can change with education, familiarity, and understanding. And so this kind of leads us into the next really important thing with kind of how can we combat ageism, and that's education. And when we think about ageism education, this is something that we should really be weaving into our curricula, starting in primary grades all the way through advanced degrees. Because research has shown that intergenerational educational activities really do combat ageism by breaking down stereotypes. So when we learn firsthand about other people, we reduce assumptions, right? So it offers time to develop relationships, develop empathy, reduce prejudice and discrimination. Also, by providing accurate information about aging to individuals, it helps them take control of healthcare treatments and options by asking questions and advocating for themselves and others. And I think it's really important that people know that, because we can empower people. And so this is kind of an interesting study. And in honor of October is Audiology Awareness Month, if you were not aware, this is kind of an appropriate study to talk about. According to a study performed on the American Medical Association, 25 to 40% of seniors over the age of 65 were experiencing hearing impairments. Instead of offering treatments and assistive devices such as hearing aids, many physicians relegated such decreases in ability as simply just a part of getting older, compared to younger people who had the same hearing issues, but they received hearing screenings and the devices they needed to correct their hearing issues. So what is that? That's ageism, right? So both groups had hearing issues. One group got treatment, and the other one, they just said, oh, they're just getting older. That's part of aging. And so, there's an issue there. The next thing is we need to correct misconceptions. And so, there's cultural beliefs and stereotypes that perpetrate and reinforce, people's beliefs regarding aging. And in some cultures, it's good things about aging, right? People are wise and they're treasured and it's good stuff. And in some cultures, we have negative stereotypes towards aging. But we do need to think about how we can call out ageism when we hear it or when we see it, because this is going to stop perpetuating the stereotypes. Also, share positive parts of aging. So in the chat box, share something positive about aging. It can't all be negative, so let's share the positives of aging. Something positive. Memories, patience, knowledge, life experience, increased confidence, yes, wisdom, learn from mistakes. Awesome, good stuff there. All right, and then finally, as a society, we need to unlearn those stereotypes, right? Aging should be embraced, not fought. So, so many times we hold youth and beauty and as the ideal by, dyeing hair, excuse me, wanting to reduce wrinkles or those kind of things. And we need to embrace aging for all that it is. So educational interventions can be shown to be both effective and affordable ways to combat ageism. But it's most effective when combined with intergenerational activities. So now we're going to talk about the importance of intergenerational interactions. And so the goal of intergenerational interventions is really to promote interaction between the different generations. And so, one second. Excuse me, I had a little tickle there. And the intention of activities is to really reduce prejudice and stereotypes. And when we think about this, parents, teachers, workplaces, community leaders really should encourage and create opportunities for people of different ages to engage. Because really, ageism requires all generations to fight back against the antiquated thoughts of older people as a burden to our society and really acknowledge the wisdom that they bring and the experiences they bring and the time and talents that they have to offer, all the things that you guys just put in the chat box. So now in the chat box, throw ideas of how kids can spend quality time with older adults. What are ways that kids today can spend quality time with older adults? That's a great one. Teaching technology. Absolutely. Foster grandparent programs. Reading, camping.
Shopping,
volunteering.
lunching.
What'd you say, Molly?
Shopping and lunching.
Shopping and lunching, dining, cooking classes, community gardening, volunteering, all great answers. Yeah, there's all kinds of ways that kids can engage with older adults, right? Unfortunately, some kids don't have opportunities to spend quality time with older adults, maybe due to death, divorce, geographic distance, right? So their only view of older people might be through society's lens, which isn't always realistic or positive. And so we do need to have opportunities to pair younger people with older adults. And so that's why it really is important for us to create these opportunities to offer time for older adults and younger kids to bond and learn through games, hobbies, activities where they can learn from each other. And so engaging in intergenerational activities can improve attitudes for older adults. It decreases anxiety about being around older adults. It can help them embrace rather than deny their own aging and mortality. And it can dispel negative youth stereotypes, right? So it goes both ways again for the older adult and the younger adult. So through intergenerational activities, we can embrace our own aging, and it's not an us versus them, it's a we.
Mm-hmm. I want to highlight that this quote by Mark Friedman, encore.org is now called Cogenerate. I'm sure we're all aware of that, but I wanted to just point that out.
So now we're going to talk about language. So as mentioned earlier, elder speak can be a way of talking where people call individuals sweetie or dear. And sometimes it's not only the choice of words we use, but the tone. And so communication delivered as baby talk is sometimes observed in healthcare facilities. And when patients are assumed to be incompetent. And I have a great example of that. When I worked on a memory care unit, there was a staff member who was not a normal staff member on our memory care unit. She was covering. And so she walked up to one of our, we call them members because we were at a VA. And she walked up to one of our members and she's like, okay, sweetie, it's time for dinner. And she had this tone and she called her sweetie. And the lady knew that, that wasn't really a good tone. And she didn't like being talked like that. And she was pretty feisty of a person. And she looked at her and she repeated it right back to her in the same tone and repeated the words right back to her in her face. And she goes, okay, sweetie, it's time for dinner. And I loved it because it was like putting a mirror in front of that caregiver's face and saying, I didn't appreciate that, Mm-hmm. And she was talking to her in baby talk in a condescending tone. And so we really need to be mindful of the words we choose and the tone we use. And so we need to remember that people are adults. They need to be talked to as adults. And we don't want to belittle people, no matter what their health status, their, cognitive status, unless, the name is a term of endearment or it's their preference, right? So stop for a minute and think about words we use to refer to older adults. Like things like elderly. What other terms do we use? Do we read? Do we hear? When we talk about older adults, what terms do we refer to them as a group of people? Folks.
I've heard people say things like the grannies before.
Mm-hmm.
Little old lady.
Little
sure.
lady. Mm-hmm. Geezers, senior citizens. There's lots of things that we might have heard, right? So think about, what words you use. Just so you know, the American Psychological Association publication manual suggests terms like older adults or older people The terms elderly and senior are not considered acceptable. Terms like older adults, older Americans, for us, older Illinoisans, which is kind of a tongue twister. Older people bring to mind competence, whereas the term elderly brings to mind frailty. So think about, what terms we use, because, our language reflects our attitude and communicates our beliefs towards others. And so just kind of think about what terms you use. And sometimes, if we've been using a term for a long time, it takes practice to kind of change over. And so just kind of, you have to kind of work at it. If you're used to using a term and you're like, ooh, I use that, just try to think about, kind of reframing that term and try to think about using something else. Okay. Sometimes the phrases we use can be representative of implicit ageism, or ageism towards oneself. And remember that these words carry weight, and internalizing the phrases can actually affect our health. So, just think to yourself, like, have you ever heard somebody say, I'm having a senior moment? Or, oh, when I was in my prime, or, oh man, I feel 100 today. Think about how you can rephrase that into something that's more age normalized and not about making it sound like it's something about being old. So if I said I'm having a senior moment, what's something that you could say that doesn't have to do with age, but means that you're having like, a blip? What's something that you could say that's more neutral, age neutral? I'm just being forgetful, right? Are my teenagers forgetful? Absolutely. I lost my keys when I was in your 20s too. Absolutely. Absolutely. Yes. You can just say like, I had a brain fart, or something like just, we all have being forgetful moments. So it's not about age. We all have forgetful moments. Okay. And so think about things, and if we say things that are perpetuating ageism, and then think about, go on to the next one, Molly. Sure. We have a quote here that I really like from Frank Lloyd Wright. And, attitude is everything. So those of us who work in the aging field, we understand the challenges and opportunities that come with aging. We've learned from research and experience that those who have a better outlook on life do tend to fare better in their health. And the same is true when a person leans into negative stereotypes of aging. And, they're more likely to have, social isolation, decline, and, poor health effects versus those who kind of lean into the positive self-perception of aging. They're more likely to have better overall health. So, they're more likely to report feeling younger and healthier. And so think about, how you view aging, and don't be your worst enemy, and don't become a self-fulfilling prophecy. So manifest the good and not the bad. All right, I think we'll go to the next one. All right, so what are others doing in this area of, trying to fight ageism? I am going to throw a link in the chat box while I talk about this page. AARP has kind of an area on disrupting aging. There's a whole bunch of people doing Ageism Awareness Day, which is tomorrow, October 7th. So if you're doing anything on social media, you should try to support that. There's a whole bunch of national aging organizations that support October 7th as Ageism Awareness Day. Last year, it was kind of sponsored by AARP with all the social media. This year, it's being led by the American Society on Aging. So the link is in the chat box if you want to click on that and get some social media and news release information. So that's kind of something you can look into. So today is very timely. There's a global campaign to combat ageism through the World Health Organization. They identify ways to reduce ageism as a target for improving human health across the globe. The Reframing Aging Initiative through GSA, the Gerontological Society of America. They talk about ways, to watch the words we use and think about, reframing words in that to think about, understand aging and contribute to society better. And then Ashton Applewhite is well known for her work in, combating ageism. She wrote the book This Chair Rocks, a manifesto against ageism. And then there's this website called the Anti-Ageist Birthday Card Project, Changing the Narrative. And they have a whole bunch of funny birthday cards that kind of embrace aging. I will put the link to that in there. And I also have a link for a evaluation, but I'm going to stop and take questions. So while I'm grabbing those links, we will take questions. So does anybody have questions? Because we're getting close to the end, so I try to hurry up and get some stuff in at the very end there. There's the link for the anti-ageist birthday cards. They're pretty funny. And then I have a link for a survey for today's session.
Or a comment. It doesn't have to be a question.
I was like, oh, we're getting close to time. Let me hurry through these last parts.
Or maybe even what you're doing in your states to talk about ageism, to combat ageism.
Oh, good question. Do you want to flip the page to the resources, Molly?
Yes, I'm sorry. I was looking on the web yesterday, the internet, and I saw something about ageism first aid, and I think that's GSA was connected to it. So I want to look into that a little bit more. Does anyone know about ageism first aid? I know they certainly are supporting, leading the way with Reframing Aging Initiative. I wasn't sure if it was the same thing or if this is something new, if anyone knows about it. I didn't have time to really look into it more.
Yeah, Deb, Ashley, I'm going to put my email in so you can reach out to me about more information on ageism in the workplace. And Deb, yeah, the U curve about happiness and how people tend to be happiest as children and older adults. Yeah, they say people are the most miserable between like 40 and 55, I believe, is like that little like spot of age where you're like in the throes of yuck. And then, yeah, people are the happiest as children and then older adults. So it's really something to look forward to. And so, yeah, the U curve of happy is a great thing to be aware of. So,
and to incorporate. Excellent idea.
Yeah. Oh, wonderful. Yes. And being aware of the age-friendly efforts is always good. And try to make your, community age-friendly, your workplace age-friendly. Universities now can be age-friendly universities, are all good things.
I love
Promote
mastery makers.
I love that. I know.
That's excellent, Renee.
So, any other questions or comments? I think we have one more
slide.
One more page of resources.
Oh no, that's
it's just our
our references. Yeah,
our references. Yeah. Okay. So, well, hopefully you guys enjoyed. Yep, I'm sure people are going off to another meeting or Zoom. Happy Friday, yay! And hopefully you can celebrate in some way the day tomorrow. So this was very timely. So everybody have a great day, and thank you for joining us today.
Good to be with you. Take care, everyone.
Yeah. Bye.